send it. I'll send it to you.
Yes, it has, yes, right. That's just a regular Monday. Yes, yeah.
Great. You're it, boss.
Reggie's gonna be a little bit late. I talked to him on the phone. He's headed this way.
Good afternoon and welcome to the Spalding County Board of Commissioners April 20th workshop. I would ask that you silence your cell phones and all other electronic devices. At this time, I'd ask Commissioner Tyler Taylor to lead us in invocation and Commissioner Ryan Bolden to lead us in the pledge of the flag.
Father, we come to you this afternoon in thanksgiving and in grace and gratitude for all that you've given to us. You gave us a safe place to sleep last night, fresh water to drink today, and nourishing food for our bodies. We ask you to be with not only those of us in the room, but with the citizens of Spalding County and all of our first responders as they take on the task of making sure that our community is safe and people feel secure. We ask you to allow us today to be able to make decisions that are in the best interest of all of our citizens and for the betterment of the county as a whole. These things we ask in the name of your Son, Jesus. Amen.
If you would, please join me in pledge allegiance to our flag. Pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioners. Item number 4, agenda item, 2027 Employee Insurance Presentation by MSI.
Good afternoon.
Good afternoon.
So you should have this presentation in front of you. I don't know if we're planning on putting it up there or not, but
Yes, sir.
we are.
If you would share your name and who you're with, please.
Absolutely. John Leggett, MSI Benefits Group. We are Spalding County's employee benefits broker.
Is this your first time
With us?
presenting to us?
Hey, ma'am, I was here last year.
Okay.
I'm ready. You can go. So I'm here to talk about the county's 2026 employee benefits package. It's up for renewal July 1st. And I always start off with a recap of this current year, what the board voted on and approved last year. So this is the 25-26 renewal recap. Last year, we renewed with our health plan with Cigna and Veracity, and we actually anticipated or budgeted a decrease with that renewal last year, 13.6%, or about $979,000 decrease, as you may recall. Began covering weight loss medications, did not make any tweaks to the deductions. The plans also remain the same. This program through Cigna does include a $50,000 wellness fund that was continued for this year, and we renewed the FSA and DCA administration with Cigna as well.
Can I interrupt you again? Would you elaborate on the $50,000 wellness fund? I'm not feeling real familiar with that.
Absolutely. So Cigna provides the county with a credit, essentially, of $50,000 that the county can use for its employees' health and wellness program. So basically, there's a number of things you can use it for, but it's related to the health and wellness. And so if whatever the county may be doing from that aspect, any money that's spent is refunded back to the county up to.
So like, for
up to
example,
$50,000.
like it, workout equipment or?
Correct.
Okay.
Did we get this last year?
Yes, it's been in the plan. And
Okay,
Miles
Steve,
might
what
could
did we
probably
do with it?
Miles, you want to share, or
Or
Kyria,
Erica?
would y'all like to share what
Me.
you're doing with this
Not Erica.
program?
Kyria.
Yeah, Miles Neville, Spalding County. We use it for our Personify Wellness Program that we use. That's what we use it for every year.
And what do we do
And
with
what is
that?
That is, you want to come up here and talk about it? You know more about it than I do. Kyria knows more about it than I do.
How much reimbursement did we get back this year from those funds, do you know?
Kyria, what was the reimbursement rate and what did we do with the funds for the wellness program?
We use the wellness program funds for reimbursement for the Personify Health program. That's like a wellness program that employees can voluntarily sign up for, and as they do different challenges and wellness or different incentives throughout the year, they earn rewards, and so we just get reimbursed for anything that we pay out for that, as well as for the fees for the program.
Can you give us some examples?
Well, there's like, if you get 7,000 steps in a day, then you get a certain amount of points. And then as you earn points throughout the year, you reach milestones, and then you get rewards. So the first milestone is $75, then the second one is or $25, then $75, then $100, then $100. So for anybody in the program, they can earn up to $300 per year doing different wellness incentives.
So, and how much money did we disperse from this fund?
I do not know exactly what we did last year. It wasn't the full 50,000. My best guess would be maybe 20,000, I think,
I don't know.
was what we were reimbursed for the program.
So yeah, and who makes that decision? Is
Which
it human
decision?
resources?
How many people are involved? Order of magnitude.
75, I think.
Okay,
75 of our employees are enrolled in the program.
not a lot.
So 75 ideally would have the opportunity to get $50,000.
They would have the opportunity to earn up to $300 per year.
Yeah, but out of that 50,000.
Mm-hmm.
All right, and the rest of the money goes back to what?
We're just, we don't have anything else that we've been reimbursed for using the $50,000 wellness fund.
We only get it unless we use.
That is
Yes.
correct. It comes out of our pocket, so, for reimbursement to the program. So if any of those funds that are not allocated or used during the fiscal year rolls back into this for the next year.
So we could tentatively give employees a membership to the senior center, or to a gym, or to a trainer or something. I'm very interested in that because I don't like the idea of leaving any money on the table. And, over, in the past years, one of the things that we've really tried to do, and I don't know if we had this insurance, is to try to create, opportunities for people to not smoke and incentivize them to do that. I just wish we were able to fully utilize those funds and make sure that more than a third of our people know that, because I'm sure more than a third of our people have health issues, which would affect how much money we spend on insurance, how much we spend on medicine and medical care. Okay.
Mr. Leggett, if you want to share with us what we can use those funds for?
That's what I was gonna say. So anything that we are curious about using the money for, we do have to get approval from Cigna. So like your question about joining the gym, that would be something we would run by Cigna, before you do anything, because they have to approve the refund.
Well,
But-
I mean, they should have a list of things that you're authorized to do. I kind of feel like in the insurance process in the past, whenever we had something of this nature, we talked specifically about what we were gonna do and how we were gonna be fully engaged in trying to recoup those funds that were being given to us for the money we pay for our premiums.
Yeah, the Personify program is promoted. It's in the employee benefits guide. So yeah, we can definitely, we'd like to see more people sign up for it. Sounds like 75 is enrolled now, but it's something we promote every year during open enrollment.
Okay, go ahead, I'm sorry.
Okay, no worries. Also, so we renewed, that was the medical plan. That is up for renewal. I'll be going over that today. Dental also renewed last year with Cigna. You can see about a $25,000 increase there. No changes to the plans or plan design. Minimal increase in employees on deduction. That is up for renewal this year. I'll get into that. We renewed vision last year, and it's a rate guarantee through 2027, so it's not on the docket this year. Same for life and disability, secured a rate guarantee through 2027. We have the carve-out radiology program, Know the Cost, that we rolled out a few years ago, and that has secured in 2025 about $74,000 in savings to the county and employees.
What was that program again?
Sorry?
What was the program you just said?
Know the
regarding
cost.
Radiology.
Know the cost. So this is the program where employees can go get an MRI, a CAT scan, X-ray at no cost, and it generates a savings to the county because they're not going to the hospital. They're going to a less expensive provider through this program. So it saves in return. It lowers the claims that the county's paying for these procedures. So anticipated savings for 2025 alone were $74,000. That's been a big success. We've had a lot of good feedback on that program.
So question to you, and I guess I'm asking this to Miles too. How would I know if I went to Wellstar and the doctor, who's a Wellstar hospitalist or whatever, gave me an order for an MRI or CT, and they do those at the hospital, my first thing would be to schedule it there. What you're saying is if I go to a private MRI site.
Go through Know the Cost, correct.
Okay.
You would call
So
Know
you
the
go through
Cost.
Know the Cost, and they would tell you who the provider can be.
Correct.
Correct.
Okay, so that's the thing. How do we get people to not do what's right there in front of them, to take that extra step? Because, I mean, is it MRI is $2,500. So are you saving $800 or are you saving $100? The convenience for the person as opposed to having to drive to another facility, making the step to do you know or no, whatever those words were you said.
Know the cost.
Yeah, I just need for it to be a way where it's flawless and seamless for people to be able to use it. And I myself would go for convenience. So how are we letting people know that this is saving money?
We do promote it. In fact, Miles and the HR group, if you want to come up and share a little bit more about this, because it has been a learning curve for the employees to get to know the cost over the last 15 or 16 months. But it does make a tremendous difference because if you show up at your doctor's office and they order the MRI or a CAT scan, you are required as an employee to pick up the phone and call Know Your Cost so that they can schedule that for you instead of the doctor doing it. Because the doctor is going to point you back toward the hospital because that's how they make a little bit of their money. But Know Your Cost actually they actually may use the hospital or they may use another facility, a local facility for an MRI, an open MRI or a CAT scan, and it's free to the employees. What a great benefit.
But who's paying for it?
We pay for it, but even though we're paying for it because we are fully self-insured, it still is creating some cost savings for the county because we're able to contract directly with the provider instead of going through the doctor or the hospital.
So you're saying that I don't even know what the deductible is. We kind of skated past that, which we're gonna go back to that. So you're saying if my copay is 20% of whatever it is, that I don't have to pay that 20%, that you're gonna pay the entire thing if I go through,
That is correct.
call the Know Your Number.
Know Your Cost.
Know Your Cost. Okay, and you said that our employees are required to do that?
Nope, they're not required to do it. It is an option for employees to do that. It would have been great if we had this 2 years ago. We brought this on board during the last renewal last year because 2 years ago when I had to have an MRI, I had to pay that 20% out of pocket. But if we were under Know Your Cost, I wouldn't have had to have paid that 20% out of pocket for that procedure. It is working well. It serves a very good purpose. I've heard very positive things from the employees who have had to take advantage of that type of procedure.
So any diagnostic procedure?
Or MRI, CAT scan, or any radiological procedures.
Ultrasound, CAT scan. Okay.
I was forced to take it, not forced, but I took advantage of it last year. I had a kidney stone. And instead of my doctor wanted to send me to the hospital, but instead of going to the hospital and, you know, they can be upwards of $4,000 for a scan, I went to Griffin Imaging through Know the Cost, and it was a great experience, and it cost me and it cost the county, I'm sure, a lot less money.
What about the scheduling? How long did it take them to schedule?
It was a couple of days. For me, I mean, I can't speak for anyone else. No one has, people call us about it a lot in the office, and they have it in their benefits book. Explains how to do it. It's very simple, but we encourage people to use it rather than going to the hospital, because we know hospitals charge twice as much, sometimes more, for those types of scans. And I took advantage of it, and I was in there within, I think, 2 days.
So we talked to them about this in their orientation, right?
Yes, ma'am.
And if they don't get sick, you know, a lot of young people don't get sick, but until they get sick, how do we know that they know to, does anybody understand? Are they getting this every year? How are we making sure that people are utilizing this?
Well, everybody that's a full-time employee, benefits eligible, gets a benefits book that has it all in there. It talks about their health insurance, their dental, their vision. It's everything. And, you know, I mean, and we talk about it to them as well, but we, you know, we encourage them to go back and look at their benefits book. And we have plenty in the office. Sometimes people come by and lost theirs and want another one. Sometimes they'll just call us and ask because they don't recall, and we do our best to help them any way that we can.
And during open enrollment, we encourage our employees to come back through this room for open enrollment, and we go back through all of the benefit packages that we have for our employees, because we want to make sure that everybody is in the know for all the products that we have available through the county.
So I'm gonna talk about you now, some numbers. How do we know, no, I don't even wanna know that. I would like to know how many of our employees, how many procedures we have the entire year, what percentage of our employees utilize that service, just like I wanna know about the wellness fund. I think we need those numbers, because how are we gonna measure the success of what it is that we're doing if we don't have something to compare this to? So I know we may not be generating, I'm not asking for anybody's HIPAA information, only that there was 75 diagnostic procedures that people had orders for, and 80% of them used check before you. How come I can't remember what
Know your cost.
We reviewed it last night.
Yeah, that's, we can get a number like that without
Because,
violating HIPAA.
I just think it would make sense for us to be able to see if it's as successful as we think it is. Yeah, if 80% of our people are using it, we're doing good.
Yeah, the tricky part is, we don't know if an employee would go to Spalding Regional or Fayette Piedmont, you know, and we don't know what they charge, so we don't know, you know, they may be 5,000 in one place and 4,000 in another, and so we can't get an exact number, but we do know that they're typically at least twice as much as going to our local one.
Right, and I'm not trying to
Yeah.
get the exact amount. I'm trying to get how many diagnostic procedures, which is something that the insurance should be able to tell us,
They can.
and what percentage of our folks use that service.
Great question.
He's got it.
I actually pulled it up. So the last meeting we had this slide in here. We should have left it in this one. 97 services over the most recent 12 months. And the hospital cost would have been around $144,000 for those procedures. No, the cost was $70,000. So that's where we come up with the $74,000 in savings to the county. So yeah, not necessarily 97 people. Someone could have had multiple. So, but 97 services over a 12-month period. And it's definitely a word of mouth benefit.
Right.
Someone says, "Oh my gosh, this was great." I thought they mailed a packet. Miles is saying he didn't think he got one, but I was thinking they mailed a packet to members when they enroll to make them aware of it. But you just call, know the cost to schedule the procedure, and it's a pretty easy program.
I mean, this is something that we need to keep in front of folks to let them know that they have this benefit, whether it's for them or their family or whatever.
In the data set that John just provided for you, we do a full package review. HR and administration does a full packet review with MSI every single year before we bring this data to you, this renewal package to you. And we'll be more than happy to share what they shared with us so you can see the numbers.
All right. The employee assistance program through the Alliance is up for renewal. It's a small increase there, 12 cents per employee per month, so it's about $14,300 for that program, the EAP. And then the voluntary wellness program, that what we were talking about, Personify is renewing it at no cost this year, so that'll continue, no changes there.
John, for a second on the EAP program,
Yes, sir.
that's a big deal to us, really and truly. We have a number of issues with fire, with 911, with law enforcement, people that we're concerned about that go through some pretty traumatic things. What do those numbers look like for us? I mean, I don't mean to pull you through the knothole.
I think I still have that presentation, everything that we reviewed. Let me see if I can, sorry, Alliance numbers. So we had 221 services. The PPM is about 238. The coordination of care, so they resell them for coordination of care, is 46 employees or members. Virtual coaching, counseling, we had 23. HR, that's not it. Organization events, 7. Work-life resources, 3. So this benefit was just rolled out recently as well. So it'll pick up, but yeah, that's, let's see if I have anything else here. I'm sorry, I'm looking at my phone.
So we had 221 people,
Touch points with the EAP,
okay?
over 12 months.
Okay. Thank you.
The next slide is our historical health plan spend analysis. We saw this last year, and we go back all the way back to 2021, 2022, because that was the last year the county was fully insured, and we had Anthem. Then we made the jump to Cigna, the minimum premium plan, and we have since moved from that to a true self-funded ASO setup with Cigna and Veracity, who's our pharmacy administrator. So this is our third plan year with Cigna and Veracity. And you can see the enrollment numbers year by year. You can see we're up this year, currently 503 employees enrolled. And then you get down to the net claim. So as you may recall, we had a significant increase with Anthem back in 2021, back in 22, which was the reason we made the move over to the Cigna minimum premium plan. And since then, we've again moved to the self-funded model. The most recent 2 renewals last year and the year before, we saw a decrease. We actually budgeted a decrease, which was back-to-back years. So if you look down below, you can see the total net paid claims year by year. You can see this year we're trending at about, we're going to come in, actually the number is just under 6.5 million. This actually doesn't include the most recent data. It's slightly, March numbers look better. So it'll probably be even under that, hopefully under the 90% range. So the claims are running a little hot this year, and I'll get into that. If you come down below, you see the total spend, and you can see total net paid claims plus the fixed premium, and then the total gross, and then what the county's total gross per employee per year is. And one of the things we talked about the last time we got together, and I'm jumping to the bottom bullet, is if you look at that 21-22 plan year and you see that 13,848, again, that was fully insured. In this day and age, a trend increase is around 10%. They call it 8 to 12, we'll call it 10%. So if we had stayed fully insured, what would that number look like, assuming a 10% increase every year? And you can see that number would be 20,275. And that's a pretty conservative year-over-year increase. So as you see, where we were the last 2 years and where we are now in 2025, 26, at that 16,816 number, really done a really good job controlling costs by moving to the self-funded model and implementing Veracity. So we are running slightly higher. Our claims are up a little bit, and I'll get into that, but again, still running. When you're self-funded and you implement these cost-saving programs that we have, it benefits the county, not the carrier. So that's the whole point of all these cost mitigation programs. Any questions on that slide? The next slide kind of gets into the why. So again, enrollment's up, and when enrollment is up, you're going to have more claims. You have 48 more employees enrolled this year, with 69 total members, 69 more members under the plan. So you've grown. Large claims are up. So we've had an increase of about 177,000 for large claims, and you can see what the driving factors are there. Cancer serving as the most prevalent there. And that is, when we talk about large claims, we talk about anybody that's over half of the stop loss deductible. So anyone that's gone above that stop loss deductible. Pharmacy factors, or pharmacy key indicators. So we're still seeing great savings under Veracity. You can see through February, we've seen over $1 million in savings under their program. And again, we have a breakdown below, but as you recall, when we left Anthem initially, the last year we were with Anthem, our claims were over 1.1 million for pharmacy, and you can see it's been cut more than in half since then. They are up this year, which I'll talk about. Diabetes is one of the driving factors as to why claims are up. GLP-1 meds, it's not just here, it's everywhere, it's across the board. The GLP-1 meds are really driving cost. Not necessarily weight loss, but for diabetes. Weight loss is obviously factored in here. So as you know, as I mentioned earlier, county voted to cover weight loss medications for this current plan year. We projected the cost to be about $230,000, and so while we've seen so far through February about $120,000 on those medications, it's actually lower than what we projected. We think it's probably going to come in somewhere in that $200,000 range, but that is obviously driving to the cost of the increase in pharmacy spend.
So I'm still gonna ask about some numbers.
Okay.
So one of the things that I know is that before you take the GLP, most people who start on a GLP for diabetes are taking cholesterol medicine, hypertension medicine, some even kidney medicine. How do we know that the $122,000 that we did spend on GLPs helped to reduce prescription costs because people came off of medication? That was, for me, that was a whole goal in allowing people the ability
For the weight loss meds.
for weight loss, but also
It's still-
understanding that GLP does the same thing whether you have diabetes. You're going to have weight loss. You're
Sure.
going to have reduction in metformin or glyphosate, whatever it is that they're using. There should be some measurable change in actual pharmacy because the increased use of GLP should be decreased.
Lowering your cholesterol, lowering your blood
Right.
pressure.
And
Yeah,
and
that's a
lowering
good
weight.
point. The problem is your blood pressure and your cholesterol medications generally are your low-cost medications. And so if you have more people taking the high-cost medications, the GLP-1s, and you see the cost of those drugs going up more and more, more people are getting on them. So it's really tough to see, okay, well, this went up, but we saw these go down.
The offset is not.
No.
No,
No,
so the
and
benefit
it's so
is
new.
actually physical rather than what
Yes.
you actually see in cost of
Yes.
the medicines they stop.
Rather than looking at it from a cost standpoint, you're looking
Okay.
look at it from your changing life standpoint.
Okay.
And you can see down below again, claims are up, but still well below where we were, which is why the county elected to cover weight loss meds. Slide 5 is our health plan renewal. And so, again, we have Cigna and Veracity is our TPA and our pharmacy benefit manager. And you can see on the left side is our current costs. Now, these are contract costs, so basically, the fees and the claims fluctuate based on enrollment. But as of today, we have 518 enrolled on the plan. And so our total admin costs right now is estimated to be about $564,000. That's going up 2.2%, or about $12,000 to $576,000. Then you come down to the stop loss. The stop loss is the biggest portion of the premium on a self-funded program, just under 1.5 million right today, and we do have an increase of 14.4 in the premium. So we're going to see it go up about 215,000. They started off, Cigna started off at 18.2. We went back, pushed back on them, got it down a bit. So that overall is about a $227,000 increase. Or I'm sorry, your annual fixed cost is about $227,000 increase, which is 11%. Then you come down below, again, under a self-funded program, we budget off expected. It's built into the contract, and even though we're self-funded, we have aggregate protection, so there's a ceiling. But from a budget standpoint, we were looking at claims this year to be about 5.9 million. They're telling us it's going up 7.2%. We're going to see an increase there of about 424,000. We may not. It may be.
That's at the end of this year, you're saying? That's what the
No,
expectation
this is for the new plan year that starts
Oh, okay.
effective July 1st. So again, there are claim factors that are built into the contract, and when you take the claim factors times the total enrolled and annualize it, they're telling us, Cigna, are saying our claims are gonna come in somewhere in the neighborhood of 6.3 million for the new plan year. And so what we do is we say, okay, that total number of 6.3 compared to 5.9 gets us about a $424,000 expected increase in our claims. And again, we've had years where we didn't run as expected, and we were significantly under budget, and that's why we've had 2 years in a row where we saw decreases. This year, we're seeing an increase, but from a year-over-year, 3-year standpoint, we're still below where we were 4 years ago just because of those decreases. So the bottom line number is the anticipated increase is 8.2% to the plan, about 651,000. No projected changes on the health plan or the employee cost. So that brings the county's net total of just over 7 million, going up to 7.65, 7,665,000, or $651,000 annual increase, which the bottom line number there is 9.3. So that was our final number with Cigna. And recommended
I don't know what PEPY means.
per employee
Per
per year.
employee per year.
Thank you for sharing that. I guess y'all thought everybody knew that.
Any questions on here?
I want to kind of go back to that first sheet. We talked about no change in deductibles, and I know you're getting down to telling us what this 8.2% increase is. But one of the commissioners who's not here, and also our county manager, had an experience where we thought that there had been funds set aside to help offset the deductible, and we're saying that the deductible is 15,000 or
1,500.
25,000.
1,500.
It's 1,500, and then when you get to a certain point, then it becomes an 80-20 split. So
annual deductible is 1,500. Okay. For some reason, I was thinking that the annual deductible was more than that.
Are you thinking about the stop loss deductible?
no, for
The
For
employee.
the employee.
per plan
employee,
deductible. Right,
yeah.
okay. Yeah, it's 1,500 and, then
yeah,
80.
but that's not total. So for me, I went past that 1,500 because I was in the hospital and wound up with a $15,000 bill. And
I know we've talked about this.
yeah,
Yeah,
Let's talk about it some more, because we never did get it fixed.
yeah, you're gonna be better to talk, like,
Okay, so
through
the
this.
plan, right, the way I understand it now is 1,500, then it gets to a certain point, and then it becomes 80-20 beyond that number.
it becomes a co-insurance requirement.
Okay, I wanna make sure that that's,
And the
And-
cap, the max out of pocket is $6,600, so that includes the $1,500. So you pay 1,500, then the plan pays 80, the employee pays 20, up to that 6,600. So I know we've talked about it,
We have,
and if you're out of network, it's different. This is all in network conversation. If it's a contracted Cigna provider, hospital, they're obligated to honor that as
right,
a
so
plan.
if you go the right way,
If you're out of network, they can balance
yeah,
bill.
let's say we stay in the network. Max is,
6,600.
That's a lot.
The Affordable Care Act, ACA, now it's over 9,000 is what, in order to be ACA compliant, you have to have an out-of-pocket no higher than around $9,000. So you're well below. Healthcare is obviously
Money.
expensive, so
I mean, if you got $6,000, you can just save your money paying on premiums and pay your own bill.
I mean, that's $500 a month. That's $500 a month.
A lot.
Yeah, that is a whole lot.
Yeah, it is.
Okay,
yeah, it's generally, 80% of the people don't even touch their deductible on an average year. So it's generally 20% of the people are using the plan. So the deductible really doesn't come into play, especially the out-of-pocket. The out-of-pocket is even rarer to hit. It's gonna happen for a handful of folks. And that's, you're right, it is a lot of money when that does happen.
Okay.
So, and that's my point. If it's gonna happen for a handful of folks, are we okay with them already experiencing loss of work or loss of time and getting full coverage once they hit $6,600? That was where this other pocket of money that we talked about, that we couldn't get put into a box, was supposed to help out. Not that it will cover the entire population, but clearly there are certain people who are experiencing this. If we got people who are cancer patients, clearly they've met that. But that's a lot of money still to come out your pocket.
Yeah. For our employees, that's a whole lot of money.
So,
And then the administration of that, so that it's not elective surgery to, go after certain things, but it's for the required procedures that are based on medical conditions that are mandated by the physician. So how is it able to be constructed? Is there a plan like we had several years ago where there was, roughly $50,000 set aside for
A health reimbursement arrangement.
Mhm.
So when you're fully insured, a HRA makes sense. When you're self-funded, it doesn't, because you're already paying the claims. So if you wanted to say, well, instead of we don't have the HRA any longer, if I'm not mistaken, Matt was here then. I worked with Matt. He worked with you guys. I think when we went self-funded, we lowered the deductible to offset what the HRA was reimbursing. And I could be wrong on that, but
we've never had a deductible that was,
higher than 15.
yeah, I think
Yeah.
that's, yeah.
But to answer your question, it would be a matter of lowering the deductible or out of pocket. You wouldn't really want to set up an HRA to reimburse employees. You're basically, when you could just have paid the claim. You know what I'm saying? Otherwise, they pay it, you pay them back, or you just pay the claim direct. And that's why an HRA doesn't really make a lot of sense under a self-funded model.
Well, I mean, I'm just, at the place that whatever that amount is, clearly if someone has those expenses, they should be able to come and say, I would like to be able to get money from that fund. I don't know how we would work that out, and we've not had an experience where we've been able to do it. But if it happened to you and Commissioner Dutton, I'm sure there's someone else that works for us who's eating this almost $6,000 worth of expenses. So I think we need to try to figure out how we can do that.
Okay. I think the county manager's got that as a task area.
Okay.
So thank you. Go ahead, John.
Okay. The next slide gets into dental, and we are looking at a small increase here on the dental plan. It's about just under 4%. You see employee deductions, so the county pays 100% of employee costs, and employees with employee plus one dependent, and then family, what their costs would go from and to, $1,248 to $1,296, $2,495 to $2,592. So about an annual increase in employees of about $3,100, and to the county, just under $8,400 on the dental plan. And that's 548 enrolled in that plan. And then page 7 summarizes everything. Gets us to our bottom line number, what we're looking at as a whole with the entire benefits package, including programs that are currently funded by the county, but with no premium changes. So you can see the health plan, the dental, vision, no changes on the vision, basic life, or there's an increase, like I mentioned, on the EAP. But overall, it's about a 9% increase from a budget standpoint to renew the program as presented.
Which sheet talks about the premium cost for health care for employee? I see dental plan renewal.
There was no change, no recommended changes to employee costs. So if you look at the health plan renewal page, the county's charging the employees annually about $954,000. And through the payroll deductions of what the county charges employees, and that annual total, like I said, is $954,000 for those 518 that are enrolled. And there's no recommended changes, no increases, recommended increase to the employee.
So the deductible for health is going to stay the same.
Everything.
What is the driving force behind the increase in dental costs?
You know, it's unbelievable what we're seeing across the board with dental going up. The rates are still very competitive, but what we're finding in the market, and this is not on the insurance side, it's on the dentist side, where a lot of dentists are coming out of the networks. So you can go to the dentist, you can bring your Cigna card and show them, and they'll file it, but they're not contracted with Cigna. So it works a lot different on dental than on the health side. And so just, I think it's inflation. I think dental costs have just gone up like crazy over the past, really since COVID. After COVID, that's when we started seeing dental claims increase, and that translated into dental premiums. We took on a bigger increase last year, but the overall premiums you guys have are still very, very competitive.
So, on the dental sheet, where in the gray it says employee only, monthly rate, renewal rate would be $31.43. That's for the regular dental plan. And what is this in the blue?
So the blue above, if you see employee semi-monthly rates, that's what the employees pay per paycheck, pre-tax. For employee only, employee plus one, and then family. So the county pays 100% of employees. So the anybody with single coverage will not see a change. Anybody with employee plus one will see it go from $12.48 to $12.96 every paycheck, and then family will go from $24.95 to $25.92. So about $1.
Okay.
So that's the summary, and then the next page is just kind of talks about our open enrollment activity timeline. We're going to be open enrollment is planned to be on May 28th and 29th. It'll run from a period of May 21st to June 2nd. So once we get everything, the benefits approved, that's when we do the employee packets, and in those packets it covers everything that we've talked about and promoting. It will include an open enrollment letter that goes in the packet, and we can highlight and know the cost. We actually highlight it every year to make sure everyone's aware of know the cost and everything that the county's doing.
You say right through June what?
I believe we have it set to go to June 1st.
All right, let me make sure. All right, so their number is 8.99% increase. And when we talked among ourselves about it, we were talking about 10%.
We'd initially used the 10% based on the information that John and his team had provided, and we come back in at 8.99, so we're using 9% for the increase for the budget.
That's all within the range of what we talked about when we went through it for that week's worth of budget.
That is correct.
Okay. All right. More questions? Anybody? Okay. Thank you, John.
Thank
We're
you.
sorry we took so long to
Oh,
pull
no,
you
you're
through.
good. That's why I'm here.
We truly appreciate it. All right. Thank you. All right. Item number 2, discussion of the FY23
COSA.
COSOP supplemental funding in the amount of $8,400. I would ask that our grants manager, Mr. Larry Wallace, share with us about this funding.
Good afternoon, Chair Davis, Commissioners, Dr. Ledbetter. Pleased to report that Spalding County has been approved for an FY23 COSUP supplemental $8,400 award from the CJCC. This award is available to us through August 31st, 2027 if needed. The grant will fund procurement of Narcan and cabinet installations across all county facilities and vehicles, and opioid overdose training for all county employees in compliance with Georgia Senate Bill 395. This is an extension of an award that we received last year for $23,000. So we have $8,400 to continue placement of Narcan in vehicles and buildings across the county. So recommend that you would accept this award, but I'm ready to take any questions you may have.
Talk to me about the difference between this Narcan that we're going to talk about, and a little later on, we're going to talk about using opioid.
This is not opioid money. This
No.
is another grant.
That is correct.
What's the difference in just the funding, the line item funding source?
Yeah, it is just a line item funding source, but it also goes back to the questions that were raised earlier today from members of the board. Maybe Chief Polk could come forward and share with us what he is seeing with respect to the total amount of monies that are going to be required to supplement the Narcan, and how we set this up on a staggered purchasing program for providing Narcan across all of our buildings to be in compliance with state law.
Yes, sir. Thank you. Thank you for this opportunity. We first got the COSSUP grant, trying to meet the unfunded mandate, through that SB 395. And it was we identified county eligible buildings, and which it was some 30 at the time. I think we've added 2 or 3 since then. But it was just to get the needed resources for the Narcan and cabinetry to put these in every facility. Well, since then, we got an extension, and Narcan does have an expiration, even though it's still eligible to be used after that expiration. But that's where the opioid request comes in, to try to update that the Narcan that we currently have. So with this COSSUP grant, since it's an extension, we'll actually use it over and above what we're going to have to always make sure we have the most current Narcan resource possible.
So do you, and I'm sure you do you have a list of all the places that you've issued Narcan to?
I do back there in my book.
So my concern is that, you know, if we purchase all this Narcan based on what we've got already, then in a year or 2 years or whenever it expires, we're in the same spot. So I was just thinking it would make more sense to either purchase fewer or issue fewer, so that every 6 months or every year you're able to get a new group of medications that will have an extended. So you'll only be having drugs expire while you still have good drugs left on the shelf.
Yes.
Because I think I had some Narcan that I got from someone in the community, and, you know, we didn't use it. I'm giving it to the people at the 7-Eleven, because anybody could use it if they're, you know, but just having it and not needing it, I don't think, I mean, this is where we are. We
Right.
probably
Mr.
got
Chairman.
hundreds.
The bill actually does require that in any county building that has an AED machine, they also must have a supply of Narcan.
And I'm not mad about that, but if you got 20 bottles of Narcan, and at the end of the expiration date, you still got 20 bottles of Narcan, you probably didn't need 20, is what I'm saying.
Right, and that's the fortunate and unfortunate thing with Narcan, is that you're actually eligible to use it 5 years after the expiration date. And so we are trying to be diligent about rotation, and all those extras are being used between the agencies themselves. And, you know, as you know, there's no rhyme or reason. We actually used 10 on a patient the other night. So, and there's a whole new strain of opioids out there that's requiring more. So I'm hoping and unhoping that it will equal out.
And Chief Polk did get an awful lot of questions from staff who are in buildings with the AEDs about training, because even though the use of Narcan is pretty foolproof, there's still concern that they might not do it right.
And I think that's fine. It should not be anywhere where people can use it without knowing how to administer it.
Right.
I mean, Good Samaritan law or not, that's still medication. My point is just not having medication sit and expire.
Right.
So even if you take the entire funding, does that mean you have to order it now? Could you order what you need? Or what are you gonna do with all this that you have already that is expired?
It'll be dispersed through the departments, that it doesn't have to be in that current date. And it was for peace of mind for people who may not be as medically knowledgeable about the expiration dates. And so we're just trying to make sure those facilities have the most current ones, and then all of the ones that could be close to expiration are given out to our other public safety agencies to have as backups and/or used within that 5 years. So we do have a rotation process.
Okay.
But you're totally right, because if it's not used, but with the later on request from the opioids, it was just to update the ones in the county identified buildings. It wasn't for any other resources.
All right, we have two types of deals we're talking about right now. We have the deal where we're talking about in the building, and then we have Narcan that we have law enforcement officers carrying.
We have law enforcement plus our fire department staff have
So-
Narcan as well.
So we have people carrying it and we have buildings. And this is for buildings.
And we will have them on public works vehicles as well.
And-
Correct.
and
We're gonna
my
be in that
issue,
mode.
my thought process is, I imagine that the fire, EMS, and the law enforcement people are routinely using theirs. We need to try to see if we're just stuck one in a building, let's rotate it out to where the people are who
Yeah,
are
that-
using.
That's
Okay.
exactly what
That's the
the chief
process
is
we're
doing.
using.
Yes, sir.
Okay,
Yep.
okay, I'm good with that. I just didn't want it to sit in a building
No, sir.
when in fact, the law enforcement folks are using it up and getting new stuff. All right, we could rotate it through to keep it current. Okay,
sir.
I'm good with that. All right, any other questions on this?
I'm good.
Okay. Next is item number 3, discuss the FY 2025 State Homeland Security SHSP grant for $14,928 to build and enhance capability in Homeland Security. I'll have Chief Polk come back up and talk to us about that grant with Larry.
Thanks again, Chair Davis. Requesting acceptance of a federal grant award of $14,928 through the FY 25 State Homeland Security Program. This is no cost to the county, no match is necessary. This will fund the Spalding County Community Emergency Response Team. We'll use the funds to purchase FEMA-compliant equipment kits for our trained volunteer responders, enabling them to perform search and rescue, medical triage, fire suppression support, damage assessment, and evacuation assistance until professional responders arrive on scene. The equipment directly strengthens the 4 national preparedness goals: community resilience, or operational coordination, mass care services, and public information and warning. So I'm asking that the board accept this award and also allow Chief Polk to talk about the CERT program that this will fund.
Hey, thanks again for your support with this project. We started the CERT program back in 2012 after the 2011 tornadoes. And so thanks to Larry to helping me out with the workload. This is actually the 3rd one of these grants, the State Homeland Security grant that we've received since 2011, 2012, that has gone primarily toward funding the CERT program. And the only thing that we fund through the CERT program, because all the instructors are fire department personnel, we just purchased the curriculum and the book backpacks that we use to offer the graduates. And so it's been a no cost to the county, and we've trained up to close to 500 people since then. So we only got 69,500 more to go. And so that's my goal. I took that a few years ago. But it's a great program. We love it, and as you can tell, a lot of people do. We've had repeat registrants, and we've had people wanting the review classes we put on too. So we're very proud of that. And we're working on the schedule to get one going in the fall.
Thank you.
That's a great program, and I know that a lot of my folks around me believe that the first person they're going to see in an emergency situation when it's a real crisis is going to be a CERT person coming around and doing all that stuff. Okay. All right. Any more questions on that? All right. Thank you all on that. Item number 4, discuss bids received for resurfacing the parking lot located at 1313 Arthur K. Bolton Parkway in Griffin, Georgia at 30223 for the consideration of awarding the bid during the April 6th, 2026 regular meeting. I would ask that TJ come forward and share information with us about this request.
Thank you, Mr. Chairman and Commissioners. It was inquired by GSP to repave their test lot. This is where they do the motorcycle tests and other driving tests as well. We have submitted 3 bids from 2 local pavers and then our current LeMig paver, which is C.W. Matthews. The lowest bid is $68,972.
And you recommend?
I would recommend to accept that bid, yes.
Okay. All right. Any other questions for?
I have a question. What's the difference in a 9.5 millimeter super pave and a 12.5 millimeter just asphalt?
This the The super pave is what we use on the roadways. This will just be a 2-inch mill, so we'll be taking off the top 2 inches and then placing the 2 inches back.
It's the size of the rock.
I don't understand what that means. What's super pave mean?
Super paving that's our requirement for paving of roads in commercial areas.
Okay, but
You on C.W. Matthews?
no, I'm looking at Southeast Paving Inc.
Okay.
So I'm saying that they're saying that there will mill and pave with 9.5 millimeters of super paved asphalt, as opposed to the other two who are going to mill and pave with 12.5 millimeters of asphalt, which, that's a difference in 2 eyelashes or 4 eyelashes. But I don't understand what the difference in the super paving asphalt as opposed to just a regular asphalt.
It's a larger rock, so it's actually a better material.
So do we know the last time that lot was paved?
I believe when it was constructed, when the building was constructed.
Like in the 70s?
I think it was early 90s. Because it has the county cupola on it. So it's going to be early to mid 90s.
So we're talking about 30 years. Okay, I'm just trying to understand why we wouldn't want to get thicker asphalt as opposed to super paved.
Right. This is the larger rock.
It's the size of the rock.
Yes.
You still didn't tell me what's the difference in, you're saying there's nothing different because you're calling it super paved. You're just telling me the difference between 9.5 and 12.5 is the size of the rock that you're sticking in the stick.
Right. They have super pave there, but it doesn't match what our super pave requirements are. What you're going by here is the rock. They're just used to that term here in Spalding County.
Okay, see, it was leading me to believe
This is
something
a
else.
contracting.
Like they was doing something special.
This is contracting wording to make it look
Yes.
better.
Mr. Chairman, based on the actual contract, there is one line that will need to be removed before it's executed.
Okay,
And that would be,
They're asking us to do something that we can't agree to do.
all right.
Which almost every contract, there's at least one thing that they ask us to agree
They
to do
try.
that we can't do.
They try. That's what we have a great county attorney to do, right? Any other questions for TJ on this one? All right. Item number 5, declaration to surplus weapons forfeiture to the Spalding County Sheriff's Office via court order. The weapons that are property of the Spalding County Sheriff's Office that have become obsolete or irreparable, thank you, and properly disposed of these weapons through trade to a licensed federal arms dealer. And there is the great sheriff himself.
I don't know. We've done this before. It's been very successful in helping save some money in our budget. We've been able to purchase equipment through different public safety supply companies, and it is none of it is ever dollars. It's always in-store credit, so there's no money that exchanges hands in any of it. The order was signed by Judge Miller on April 1st and filed with the clerk's office. The list has about 285 items on it. All of those are not guns. Some of them could be anything from magazines to individual bullets. There's even some walking canes that are listed in there. Anything that is on the list that's illegal will be destroyed by the company that gets the bid. And that's pretty much where we're at right now. We're just doing something we've done before.
so you mean illegal, like they made a gun into something it wasn't supposed to be?
Well, it could be like a sawed-off shotgun. Those would be destroyed. What more than likely they've done in the past, these dealerships do, is they'll take them apart, take the spring screws, grips out of them, destroy the frames and the barrels so they're non-functional, and just scrap those pieces.
Okay. He wants to see. Okay, any other questions about this? Thank you for doing this, this is a helping them.
Yes, sir. Thank you.
Bigger. All right, item number 6, discuss the acceptance of $1,167,546.30 LMIG LRA funding from the GDOT for the resurfacing of 3.65 miles of roadway to include the county match of $321,581.43 from excess T-Splosh collection of our match. And I'd ask TJ to come back. Welcome back.
Thank you, Mr. Chairman and Commissioners. This is an extra grant from GDOT, similar to what we've received the last 2 additional years. They had extra funding to add to the current LMIG. And what we did is then we went and selected roadways that are inside of your current PCI scores that are in the red. And those are scores of 25 or below. And you can see we included a map that shows where these extra roads would be. Did I include it? Yeah. Next one. Oh, okay, guess it's not there. This does represent a road in each district except for District 3.
1.
No, ma'am, that's not correct.
3.
Beaver Road is in District 1.
Beaver Road.
That's off of Dundee Lake.
Okay.
And District 3 has,
That's his district.
That might be 3.
That's
3.
his. That's Clay's district, Dundee Lake.
it's on the south side of Dundee Lake Road. Okay, but District 3 has no, as of year 5, with the year 5 paving, we have addressed all of the red PCI scores below 25.
That's
Which
a
is
good
excellent.
My district in good shape.
That's what
You
that
have
says.
no more PCI scores of 25 or less.
That's a
That
good-
is correct.
You got all the roads before whoever was left.
Okay.
Okay, okay.
I just don't understand why I cannot get picked to have some roads in my district paved. I'm just gonna take it as a personal affront.
Okay.
The city of Griffin would be happy to pave all them city streets for you.
Okay, any questions?
No.
All right, thank you, TJ.
Yes, sir.
Item number 7, discuss plaque recommendation to move forward with T-Splashes, with T-Splosh pads, excuse me, with splash pads, excuse me. I would like to ask Director Amberger and Commissioner Quinn Flowers Taylor to share with us the request for the splash pads.
Yes, sir. Thank you, Mr. Chairman and Commissioners. Would be glad to have the assist from Commissioner Gwen Flowers Taylor at any time. The plaque had sent a recommendation originally to the BOC in response to recommending 2 locations for possible splash pads. And it's my understanding that the BOC did not accept those recommendations. So Plaque at its last meeting asked for this board to reconsider those recommendations.
And the reason they did was because this is a 3rd recommendation that has come from Plaque about splash pads. And so the discussion is that with 3 recommendations, if we have not come up with anything, we, Plaque, that the Board of Commissioners will accept, then the Board of Commissioners needs to figure it out, what they want to do. This is a volunteer group, they're not getting paid, and every time they make a suggestion, it's sent back to them.
Okay.
Hence the letter.
Okay. As I remember, the last issue was the cost.
Well, no,
I mean, that's
there
what-
was
I mean, that's-
the last recommendation was to place one facility at Fairmont and one facility at City Park. because they both had infrastructure, they already had restrooms in place, blah, blah, blah. The original request for the first splash pad came for Carver Road. And the reason Carver Road was nixed was because we were not able to dig a well or find a well that would provide enough water. Well, if we're doing the recirculation for the water anyway, what does it matter? Then Carver Road can get something the same way that Fairmont or City Park can. There's a restroom there, there's a parking lot there. So, as I said, we didn't address that, but if anybody's asking me, I think we need to go back and look at Carver Road, because that was one of the things that I think we all agreed with. We promised a certain commissioner who was here before and shared with them that it was because of the water. Well, it's really not because of the water anymore, because we're gonna be paying for the water wherever we put it, because we're gonna be using recirculated water. So, it's really up to us to do it. This is a very nice picture. I'm old. I'm thinking just some water coming out the ground. Because as a kid, if I had some place to run through water, whether it was a fire hydrant or the water hose, I just wanted to get wet. This is pretty, but it's also expensive. So I'm at that base level in terms of decisions. Leisure Services also addressed the fact of, and Commissioner Dutton had suggested that we put the splash pads adjacent to fire stations or the rec center so that people would have to come inside of those places to get into it. The Leisure Services Board was like, this is a safety hazard. They're gonna be wet. They're gonna be running on, walking through the building on tile floors. That just doesn't make sense. And if someone wants to use the aquatic center, and you know how hot it gets here, if you need to come out at 11 o'clock at night and sit so you can get cool, you don't need to be able to come through the rec center to do that, or the fire station. So that was the other reason why Platt was like, we don't have anything else. This is what we suggested. So.
And I like the fact that you say it coming up out the ground. I don't think that'll oppose somebody getting hurt or somebody tearing up anything. It coming up out the ground. And of course I wanted it in District 3 off Carver Road. So, yeah.
Well, I think the important thing is that we have nothing on the ground. And since we started this, and TJ, don't share your minutes, because he's already shared them with me, how many times we've had a meeting about this, which is way more than y'all need to know about. We were gonna be able to get 3, but that money has changed so much and the cost has gone up, so now it's only 2. And if we keep messing around, it's gonna be just 1. So we need to stop playing and make a decision, either do it or do something different.
You know, I don't know what Chief Polk, what we called when we were talking about the cooling out there, out at Carver Road, and we did that and the kids, we just had a fire.
Just water.
Yeah,
Pouring water out, and the kids were just loving it. They ran through it, they did stuff. There wasn't any sliding and doing all that stuff. It was just good fun for them just to run through that water. Now Chief Polk had a whole bunch of other things around there too, but the kids were just interested in getting wet and running through it and running to the other end. So, okay.
And Fairmont, you know, Fairmont is in my district, but Fairmont has the volleyball, well, they used to have the volleyball. They have basketball inside, basketball outside. They got the community garden. They got the playground. They have a good bit of stuff for people to do. And while it would be nice to put a splash pad there, there's nothing at Carver Road except for a dog park. I would much rather, in Gwen's world, I would like for us to go ahead and build one, put it at Carver Road so we can get a real price, and then figure out if we need to do something different on the second one. But we need to put something on the ground.
All right, so your recommendation is build one at Carver Road now.
And it's my understanding from hearing what you guys are talking about, this is build one at Carver Road with just water coming up out of the ground, so.
Just a basic splash pad.
Yeah. Close loop splash pad. Take the water that's, put it in there, just reuse it, let it go down
Yeah,
into,
see, I think TJ says you have to build something in the ground to work that, right?
It would need to be filtered and chlorinated for Department of Health regulations.
Right.
And it'll be a tank to hold the amount of, to cover the GPMs.
So you still have to put a shade structure out there. You can't expect people to come out and bring their kids out and sit out in the sun. You gotta have benches. There's a restroom there. You may have to put some more gravel down for a few more parking spaces. But I mean, I think we just need to do it. And if people don't like it, believe me, they gonna tell us. But I'm pretty sure if you can take your kids somewhere and just let them run through water for 45 minutes or an hour and you can just sit and watch, people will be happy with that. I'm sure the kids will be too.
any other comments or questions about it?
I'm on board.
All right, so we're on board for one at Carver Park as soon as we can financially get it going and doing all that stuff. So we're gonna vote on that this evening at the 6 o'clock meeting. We're all square on that?
So TJ does not have a model for just a plain water park.
If it's just coming out of the ground, I just need to know how many
Heads?
squirters you want to come out of the ground. Lack of a better term, how many things of water do you want shooting out? Up to, less than,
Okay.
because that's what affects the price.
Right. Well, I mean, we looked at the splash pad at Henry County. We looked at the splash pad down at I can't think of the name of the church in
Christ Chapel.
Christ Chapel. Very simple, very plain shade structures. No big bells and whistles, but it's full. When it's on, it's full. People are there. They're coming there all day and all evening. So
But nothing above ground, just coming out of the ground is all we want, correct? Okay. Make it happen.
All right, thank you. Item number 8, discuss sentence enforcement annual contracts for renewal. I would ask the director, Marty Matthews, to step forward and talk to us.
Hi.
Hello there.
So by law, we can only do our contracts for 5 years, and then we have to revisit them every 5 years. Y'all approved for my department to start in July of 2023, so we just went with 3-year contracts, and so all of those will expire for all 3 courts that we service, the Spalding County State Court, Superior Court, and Magistrate Court on June 30th of this year.
All right, we're all square with on the
I
contract.
had just asked for one, change in the opening line, just because it refers to to Spalding County and then Spalding County sentence enforcement throughout, so I'd asked if, Marty would just make the one change to say that this agreement is made by and between Spalding County by and through its department known as Spalding County Sentence Enforcement.
You're good with that?
Yes, sir, those changes have been made.
Okay, all right. Any other questions about that? That's all 3, we'll do all 3 of them for that.
this is 3 different agencies, right?
Right.
3
Magistrate,
different courts.
Superior-
courts.
Yeah, Superior Court and,
Magistrate?
State court.
State,
okay.
okay. All right. All right, thank you.
Thank you.
Item number 9 is to discuss the purchase of Narcan using opioid funds. Glenn, if you'd step back up here to make sure we're understand the difference between grant funding that we're talking about and this funding.
Yes, sir. This is, at the time, we didn't know we were getting the COSUP. And like I said, we were only trying to update the actual Narcan in the qualified government facilities. So we've only asked through the opioid funding for that would update those county buildings only at this time.
What's the price on that?
Ooh. Remember the price there?
What was your question,
$3,898.70.
What was the cost? What's the cost that they're asking for?
$3,898.70.
Thank you.
All right, I got $3,000 for Narcan out there.
And
Almost
that's in
for-
addition to the $8,000 grant?
Yes, ma'am.
Yes, ma'am.
The initial price for the Narcan was $31,400 and some change, so $31,500. This is for a recycle of those that are running close to the expiration date. So the total price is $8,400 plus the 3, so we're right at $11,000. So it's a little bit less than half of what the initial cost was.
And we'll actually require more cabinetry too with the cost for any additional buildings we want to include.
All right, I'm good with this. Everybody okay with this?
So the ask is $8,000?
The ask for this one is $3,000.
$898.70.
Okay. Item number 10, discuss the bid for Wyoming Tyus Walking Trail. It's a grant fund. Director Imberger? Oh, Larry, I'm sorry.
Good evening again, Chair Davis, Commissioners, Dr. Ledbetter. Here to request the board's approval to award the contract for the Tyus Walking Trail Resurfacing Project. This is fully funded through the Georgia EPD's Tire Derived Products Program. As you recall, you may recall, we were awarded $160,955 from the EPD. Covers the entire resurfacing of the 12,465 square feet, the walking trail at Tyus Park. This project also diverts approximately 58,000 pounds of scrap tires from landfills, turning this waste into a durable, accessible walking trail. You previously authorized the grant award. Since then, we've completed the full procurement process. We received 3 bids, with the lowest being Bliss Products and Services for $152,539.46. This replaces the entire walking trail with a 1/2-inch rubber surface. And so Bliss is a Georgia-based company that has worked with the county in the past. And so we're recommending that Bliss be awarded this contract in the amount of $152,539.46. I'd be happy to answer any questions.
I do have a question.
I'm sorry.
So is this the walking trail at the soccer field or the walking trail around the lake?
This is at the soccer field.
So my question would be, why wouldn't we also try and get a grant for that trail? Because isn't that trail around the lake longer than the track over by the playground?
I would have to defer to TJ on that one, but we're trying not to be greedy and trying to do one trail at a time. So this is our second one. We can only do one grant at a time. And so.
So that's my question.
If it
Were
comes
you
up
not
again.
able to apply for?
Right, we could not do more than one at a time.
Okay.
And so I'm also taking my direction from TJ and Greg as to which one they want to apply for. And so this time it just happened to be that one. Next time we could do the other one.
So the previous one was at Airport Road?
No, Sunnyside.
Okay, Sunnyside, I hadn't seen that. Okay.
And we're redoing what's there, so as not to get in a situation we had in Airport Road, we're trying to replace them at regular intervals.
Yes, good.
So this is not taking everything up. This is just putting more stuff on?
The rubber will come up, and then we'll put down new rubber.
And that's a great walking.
The entire thing, or are you just gonna take pieces of
The
it?
entire thing, just like we did at Sunnyside.
Okay.
Yes, ma'am.
This is for, if anybody has never walked on it,
It's a really good track.
it is a really great place to go walk because of for especially people who have knee issues and ankle issues, it is a great place to go walk. Okay.
No
Mr.
match?
Chairman,
No match.
Okay. All right, thank you.
there are a couple of items in this contract as well, and in the related terms and conditions agreement from their website that will need to be changed.
Okay. Thank you. All right. Item number 11, discuss the FY 2027 CSBG allocation contract notice increase. Mr. Wallace, you're here again.
Yes, thank you, Chair Davis. I'm here to request approval of the FY 27 Community Service Block Grant Funding, which will allow us to provide critical service to low-income residents throughout Spalding County. Each year, Georgia Department of Human Services allocates funding to Spalding County for the CSBG program. We have been awarded or allocated $154,121 for federal fiscal year 27. All services will benefit low to moderate income individuals and households in Spalding County. Last week, the CSBG Advisory Board approved the tentative budget for these funds as follows. $33,000 to the Salvation Army to support the Salvation Army Summer Camp Tutorial Program, $22,000 to Leisure Services to support the Spalding Aspire Youth Tutorial Program, $69,000 to Senior Nutrition Program to provide home-delivered meals to an estimated 18 low to moderate income seniors, and also $30,121 for CSBG program software, data management, and also to provide training for CSBG board members and staff. The board's approval is mandated through federal regulations. All programs align with our strategic plan and community needs assessment that addresses educational support, food security, and senior services. There is no match required. It's 100% federal funds. And so I respectfully request that the board approve the FY27 CSBG budget in the amount of $154,121. Happy to answer any questions.
Okay, we're all good? All right. Thank you, Larry. Item number 12, recommendation for Spalding County CSBG Advisory Board appointment.
Yes, thank you again, Chair Davis, Commissioners, Dr. Ledbetter. Here to recommend the appointment of a member to the Spalding CSBG Grant Advisory Board. You approved the resolution establishing the board last June, and we had a board member actually resign back in February. And so we made applications available to the public, and they were posted for 30 days. We received one application. The application was reviewed by the CSBG staff to verify that the candidate did meet the eligibility requirements outlined in the bylaws. And last week during their meeting, the CSBG Advisory Board recommended the appointment of Travis Bowie as a low-income representative. Travis is a resident of Griffin, is employed by Spalding County Leisure Services, and brings experience in community engagement, recreation program, youth and family initiatives, and partnerships with nonprofit and civic organizations. She is the founder of Off the Mat Full Circle Yoga Initiative and has demonstrated commitment to serving underserved populations. She has not previously served on a county board or commission. This appointment will place the board membership in full compliance with the federal requirements of having at least 1/3 low-income representation, exactly 1/3 elected official representation, and then the remaining private sector representation. I recommend that the board accept or approve the appointment of Travis Bowie to serve the remaining term of 1.5 years on the Spalding County CSBG Advisory Board. Happy to take any questions.
Travis is great. I like Travis.
Okay. All right, we're all square with that? Okay. Thank you, Larry. Item number 13, discuss easement agreement for Atlanta Gas Light Company located on the county-owned property adjacent to the Regional Griffin Spalding County Airport Authority.
Mr. Chairman, this is for relocation of the Atlanta Gas Light Company easement, and it would be, it's not considered a gratuity as it is between governmental agencies.
Okay.
So my concern, if Stephanie's finished, the piece of property that is a county property is marked in what? The blue line is the airport. Where is the piece of property that belongs to Spalding County?
Off the top of my head, I'm not even sure which one is Spalding County. Steve, do you?
So my concern is this. I feel like the piece of property that we have that's in that area is 5 or 10 acres. And the idea that the utility company, and you got 543 acres that you bought for an airport, and you need them 5 or 10 acres that belong to Spalding County right next to the airport to run your gas line? Come on now.
The gas line has to be off of the airport property, which is why it's being relocated, along with the other utilities as well.
I get it, but you know, That's what I'm saying. They, all this other land, they can't find nothing else, but why they can't go through the city?
They are. They're doing
Right here?
both.
I know that's Spalding County land.
The city has approved, that easement as well.
But see, I can't see what this means. I see a blue line, but I don't know what that means. I don't know which one of these is a gas line. One says a permanent easement.
So the gas line, the red line is the permanent easement, so that's the easement area that will remain. The yellow is the temporary construction easement, so that's where they will need to be during the construction of the permanent easement. And then the blue line is the airport property.
So they don't need permanent easement. Cause I thought you said they wanted to relocate the line.
They are. The permanent easement is the red.
Okay, but that's not on our property.
It is adjacent to the property. It is our property right now. The airport is our property right now.
No. I'm talking about the piece of property that is titled to Spalding County as a separate piece of property, not involved in any of the purchase part of the airport. Now, I know that we, the city, and the airport authority and DOT are all in partnership, but I'm talking about this particular.
Well, what Dr. Ledbetter is referring to is the fact that Spalding County is actually condemning or has condemned these properties on behalf of the airport, and therefore currently the condemned properties that the declaration of taking is in the name of Spalding County. We have not yet conveyed that property to the airport. The county will be conveying that property to the airport, but has not done so yet.
Correct. So
This easement needs to be in effect
So you
before
haven't,
that.
the county has not condemned our property, our piece of property.
correct.
Okay, so that's all I'm asking about, is that piece of property. So are they saying they want a temporary easement for construction? Because I need to understand that they're not trying to take that piece of property to put a permanent easement on it.
They do, the red line shows a permanent easement that will be inside of the new airport once we convey that property to the airport authority.
Okay, but I'm trying to tell you, as far as the piece of property that the county owns that is landlocked, they will only have a construction easement.
Correct.
That's where, yes, the yellow
Correct.
represents just a temporary easement, and it will go away as soon as the construction is complete.
So the permanent easement is not on this piece of property that I'm concerned about.
That is correct. All of this permanent easement is inside of the airport authority.
Okay, I'll get my blood pressure back down. Okay.
Okay. All right, we're all good? Okay, thank you. Item number 14, discuss Griffin Spalding County Airport.
Okay. The memorandum of agreement between the FAA, GDOT, the City of Griffin, Spalding County, and the Airport Authority, and also the Georgia State Historic Preservation Office regarding the new airport, it requires an annual summary report, which our consultant, Croy Engineering, has provided each year, and this is just the updated version for this year that lets you know the items that have been completed, the items that are still in progress, and any items that are being reevaluated.
If you notice inside of the report, there's a table that outlines exactly what our consultant has done for the new airport month over month. It indicates that we've made purchase of the property. It indicates that we have done some grubbing along Sapelo Road. In next year's report, it will indicate that there was groundbreaking that took place. So every year you will get an update of all the work that has proceeded over the last 12 months.
So, in real life, by 2025, this was supposed to be further along. And so, because of the historical farms and the rocks that might be an Indian burial place, we didn't get there. What I want to know is, where is our money that the airport authority is supposed to be giving us back? I'm looking at you, I know you probably don't know, but I have a problem with
It is
Stop
in
signing it till they tell us where our money is.
the money is still in the hands of GDOT, and I would love to go into further detail, but it's probably not a good idea.
Okay.
So I asked that same question multiple times over the last 2 weeks.
I mean, y'all might be okay with it, but I'm still trying to find out where our money is.
It did not imply when we gave the money up and said that we were gonna get it back, that it was gonna be,
We were assured it would be back in 90 days.
In 90 days, yes, that's correct.
this is beginning to be like.
So,
FEMA.
yeah, they might need to table that till somebody can tell us something.
This is just a report given to us. There's nothing on this that requires our action.
It's just a signature that's required to acknowledge basically that it's been provided to you.
Yeah. And if we don't sign, okay.
You
If-
could potentially
So
hold
if you
that
don't
money.
sign it, then, SHPO becomes involved once again, which is a large part of the reason that we are continued to be delayed.
Okay.
They need to do their due diligence. And I mean, I can say this because I've been here long enough from the first dollar that was spent up until the last. And every time that they have told us that, oh, I can hear myself good. Every time they have told us that we were gonna get reimbursed, it's never materialized. And I'm not mad at them about having problems, but we need our money. Because
I
I'm
can
sure
assure
they're gonna
you that-
ask us back for some more money like we just paid $1 million.
I can assure you that the reimbursement the money is there, it will materialize. I just have no control over the timing.
Well, they need to just tell us something then. That's what I need to hear. I need something in writing saying, yes, we know we owe y'all money, and as soon as we get it, you gonna get it. Because I don't want this to go on forget.
And honestly, I don't believe the airport authority would have any problem with doing that. Do you, Ryan?
Oh, I forgot you.
He's on the board.
My mouth shut. He said nothing.
Sorry.
All right. All right, we're done.
Sorry, Ryan.
Item 15, discuss the 2026 trustee assurance agreement with the Spalding County Water and Sewage Facilities Authority, and the general manager is here.
Good afternoon.
Afternoon,
So
sir.
what you're looking at is one of two documents that we've been working on since the county resigned from being the trustee with community services. So you have the trust indenture and the trust assurance document. So this is just a formality. We're asking for the chairman to sign this document so we can send it back to community services to begin the process of getting the state approval for us to become the trustee.
Mr. Chairman, you're not actually approving the document itself tonight. The vote is just an acknowledgement of the termination of the prior trust agreement.
Okay.
Yeah, you're basically acknowledging the fact that they have entered into agreements with us and
We're all the
letting
way out.
the other one go.
You're out. You're no
Yes.
longer a party.
That's
correct.
what we want,
Yeah,
out.
we like that part. Okay? And thank you for all this effort to get this done. This has been a long issue to be able to get it done, so I appreciate you all's effort to do this. All right, thank you, Joseph.
You're welcome.
Item 16, discuss amendment to the ordinance route to travel through truck, Part 6, Chapter 2, Article A, Section 6, 2004.
Mr. Chair, do you want to read 17 as well,
Yeah,
and then we can
thank
just
you.
discuss both?
Discussion of amendment to ordinance route to travel through trucks, Part 6, Chapter 2, Article A, Section 6-2007. I believe,
This is the permit piece?
So there are actually there's really three parts to this. The first is to amend the original no through trucks ordinance. And the only thing that it changes two things. At the end of section 6-2004, at E, it adds as provided in section 6-2007 and pursuant to policies established by the Director of Public Works and approved by the Board of Commissioners. which may be amended from time to time. So that just ties those two ordinance sections together so that it's clear that the permits are a requirement and where you can find that information. And the second part of that is the policies, and there's going to be a resolution tonight for those policies and fees that Director Enberger presented to you last month. And then it also takes out that approval by the Georgia State Patrol, which nobody even knows where that came from in the first place. And then the section 6-2007, pulpwood and logging operations, we added to the title commercial construction development, residential housing development, because permits are required to cross those county ditches as well. So it's pulpwood and logging operators or contractors who desire to cross county ditches to enter property for the purpose of cutting timber or for commercial construction or development or from any residential housing development with the intent to develop more than 4 residential structures within the development shall secure a right-of-way travel permit from the Public Works to cross that ditch.
Okay,
A question.
yes.
Now, did we consider the cost of what it takes for us to fix whatever it is that people drive over when they cross ditches? Did we consider that in the impact fee? Because generally a lot of this is being related to new construction.
Yeah, we considered all of the allowable charges inside of the impact fee with exception of one, and that's building new roads. Building new roads is a really touchy one because we are requiring developers to build roads for us now based on our requirements of what you talked about earlier, which is super paving. We require them to build the road base up very, very high and then put the right amount of asphalt on top of it. So if we impose an impact fee for new roads, really that would create a fund that would not be needed for a considerable amount of time because of the way that we are requiring developers to build the roads for us. The only place that I can think of in the last 5 years that would have been anywhere near applicable would have been on Pine Hill, the one that we're working on right now, which actually got paid for by GDOT with LMIG funds. But that would be the only road that I could think of in 5 years that we would need to have that impact fee for. And with that being said, it's better for us to use those impact fees in other areas. With respect to building out drives with culverts and ditches for the development, we're also requiring those same developers to construct that for us based on the standards that TJ and his team are putting together. And then we accept those once we feel comfortable that they are constructed well. In fact, we just recently had a developer up in District 5 that had to go back and rebuild probably 2, maybe 3 times, TJ, for the work that was done up on the north end of the county, simply because that developer did not build it to our specifications, and it created some challenges, and we didn't accept the road. So that there are some considerations that we put into play, and we want to make sure that we bring that back to you. Remember also that this is the year that we are reimagining our comprehensive plan. So part of that comprehensive plan will come back to you over the course of the next 12 months. In fact, we're going to present the bid for the work at the first meeting in May for our comp plan. And we will be able to, over the course of the next year, really contemplate whether or not we need to reopen that comp plan and review it to make sure that we're looking at things inside of our comprehensive plan and our impact fees to satisfy the requirements in our community.
So, that was a great answer. It wasn't the question I was trying to ask. So, I'm out on Highway 362. Someone comes out there, they have 100 acres, and they want to build 20 houses all along the road. Well, in order to get into that field, somebody's got to make a driveway and they gotta drive in there with their construction truck stuff. So that is the piece that the work that has to happen in order for them not to mess up the right of way is what I'm talking about. Are we adding that onto the cost of what we're charging people to build a house in terms of the impact fee? Not necessarily build a road. I'm saying when we look at the impact fees, they base it on different things that would affect the community. Well, in terms of us having extra cars and trucks to continuously come across a place that was just the right of way in a ditch is an impact. So I'm just saying, did we sell ourselves short? Because clearly it's an expense that we're incurring right now.
We are also requiring under section 6-2007, the contractor or the developer to install the culvert pipe that goes under the road.
So that would be culvert pipe to our specifications.
Yes,
That is
that's correct.
Okay.
And we require them to build a construction entrance as well. So that construction entrance may be different than the original entrance or the final entrance that's being constructed for the development. And if that's the case, then they have to take that construction entrance back to the way that they found it, or better, once they complete the construction.
Okay, I'm just trying to see if we're getting all the money we're supposed to get.
I'm with you.
He and TJ are pretty good on it. Okay.
So what we have tonight is that we're going back and amending the original ordinance.
The original no through trucks ordinance, yes
Right.
ma'am, that's 6-2004. And then also amending 6-2007
To add,
to add commercial construction development and residential housing developments
Okay.
with more than 4 residential structures. And then also to approve the policies and permit fees.
okay, is that gonna be a separate item?
Yes, ma'am, that would be a
Yes.
separate item. And all of these are gonna be under first reading, so we'll get to hear this again in May.
Okay, but is it on here?
It's not on for the workshop discussion, but it
Okay.
is on for the 6 o'clock meeting, and it is a
Okay.
part of your packet.
Oh,
Which is why I wanted to go ahead and mention it.
All right, got it.
Item number 18, continuation of the board's 2020, FY 27 budget discussion regarding managing solid waste effectively. We had asked that during the budget time that the staff put this on so that we could have an opportunity to talk among ourselves on what's our long-range plan. What are we looking at to do with solid waste? So this is our time to talk about it. It's unfortunate that James isn't here to be able to talk with us about it. Thoughts?
So, I don't think that this problem that we have is a one and done. The people in the district where I live almost all have either city pickup or they have somebody to come by and do roadside pickup. And they live right next door to each other, so it's just an easy thing. But in some areas in your district, and even more so in Ryan's district, you gotta go a minute before you get to the next person. So I think there may be some areas where we may not be able to change things, but I do think that overall, we need to go to roadside pickup. And if we decide to leave some centers open, the consideration should be for the areas that are the most sparsely populated. And I definitely think that we need to do a scheduled either day or time during the month, or how it is for bulk pickup. Because that will definitely, not doing that will net us mattresses, all kinds of stuff on the side of the road. So, I mean, that's easy for me to say, because I don't really, that's not a problem in my district, and for you where you live either. But I recognize that it's not the same. They have a whole different thing. And so if you live way off the road somewhere and you're, heck, I don't like to walk 70. If my doctor says that I can't walk up to the road, then I need to be able to know that the person that's picking up trash is gonna drive down the driveway to come pick my trash up. So, I think we talked a little bit about trying to put a bid out of service, but we just, I think we'll have to do a little something different in certain areas. And some people may say that that's not fair, but the county's not built the same way all over. So we can't do the same thing in terms of this. For me, that's what I think for everybody. I don't know, what you think, Ryan?
I actually agree with Gwen on this one. Just the rule setting of my area, I mean, if, it would be devastating to my people if we was to shut down like Blaylock. Cause it's probably one of the most used, other than Carver Road. But then you get like James down towards Orchard Hill, and Aikens is important to a lot of them folks. And even though it's been closed down, I hear more people complaining about Aikens being closed and just being used for bulk on Saturdays. So it's gonna be area specific to who this affects the most. And I would still love to hear some ideas with, you know, bidding this stuff out and working with some of the sanitation companies, just to see, just to, you know, keep it open, keep the dialogue open, see if we can come up with a better idea.
And we need to look at the money too. You know, it's a whole lot different looking at, if you're trying to cut money, looking at only having 2 collection centers open on a daily basis. And if you live in one of those other areas and you just got to go, or you just don't want to pay, then, you know, I'm kind of like, we're all in 30223 or 30224, but I think clearly if your address is XYZ, you need to be making some arrangements in the area in which you live. So I think it needs to be planned out, and we need to geographically know the areas who are still going to be served. But I think overall, we just need to keep trying to, just like we're doing the CI, we need to be chipping back at it.
Yeah, I think this is probably, Reggie, I'm sorry, I didn't, comments from you?
How can we utilize, I know I had talked to you earlier about utilizing the CI to do that. And I talked to Warden Sellers, and he was like, it could be a possibility that they can utilize it without the high security and bring in the inmates that he chooses to be over there and have somebody.
The only problem I have with that is security. So how many vehicles come through that have weapons? How many vehicles come through that may have construction material that they could use as weapons? We have to be thoughtful about how we utilize inmates for this type of activity.
Just say like if we get inmates that about to get out, you know what I'm saying, that it'll cost them more to do something wrong, they about to go home. If we utilize those kind of inmates instead of
We can take a look at it, but we can take a look at it, but it really would be a challenge for us to have that extra scrutiny for the inmates, because you just don't have the inmates. You've got to have the officers there that oversee the inmates to make sure that they're not doing something that they shouldn't do.
I thought we don't have minimum security.
We do. We've got many minimum security inmates now. That's
So, but
one
I
of the,
thought they had moved to medium security.
sorry, please forgive me, medium.
Yes.
Meaning that
That's
they
what I meant. Please forgive me.
require more. And the other thing is Reggie, and I don't know if you've ever seen this, but I used to walk in City Park every day. And I've seen people come out there and leave stuff in the trash can or right next to the building for the inmates coming. Maybe it's cigarettes, might be pot, might be a cell phone. But, you know, they in jail. They trying to get the hook off. You know, so you can't get mad at them for trying to do what they do. And so that puts us at jeopardy. I saw that with my own eyes. So these are minimum security people. So you get them out in the trash dump where knives and wires and different stuff that people have thrown away, you put them in a weapons factory, you know, or chemicals or whatever else that people throw away. So, you know, and the only other problem with that is that there is no guarantee. I know the Warden Seller says that he can get people, but man, ask TJ. They can't even get people who know how to operate a lawnmower without tearing it up. You know, a weed whacker.
Okay, you're trying to do something with, internally getting a contractor to do.
We actually put that out for bid and received 0 bids.
Okay, so, all right. Okay, I think that, we need to think through this and we're not trying to do that starting 1 July.
Okay.
We need to talk about this as starting, 1 July a year from now.
Mhm.
We've got to have to get contracts out. We're going to have to get the publicity out, the media campaign to be able to do this. And what we want to do, I think, is thinking about, are we going to just go to a couple open
Yeah.
and and then start talking about curbside pickup? And if we do this a year from July, we have plenty of time, in my opinion, to be able to get to everybody, so everybody knows what's happening. If we tried to pull the trigger this quickly, even 1 January, it's too quick for, I believe, to get the population to
I agree.
understand what we're trying to do.
I agree with that.
Okay. All right, we're all square. You okay with that, Ryan? Okay. All right. Item number 19. Excuse me, you have what you need on?
I do. Yes, sir.
Okay, thank you. Presentation of the design of our Legacy Museum. Kelly, are you, okay.
Hi, thank you for having me. Good afternoon. And this is, after you've listened to all those numbers and that, this should just be an easy presentation for you to sit back and enjoy. Hopefully next time we talk, I'll be able to give you a grand opening date. We're that close. The light is bright at the end of the tunnel. I have a meeting Thursday, and hopefully I can finalize that sooner there. Okay, I'm going to show you some pictures here that have come from our design team. Cooper Carey, we're completely done with the design. This is the entryway timeline. I'll let you read for yourself what's in each room. But we even use the drinking fountain, as you see, as a way to tell a story. So there's no space unused in the museum. Next room. Next slide, please. Oh, yes. This is Gallery 1. This is our heavy room. This is where the emotion and the impact is. This is our civil rights room. We talk about the summer of 1970, which was historic here, the swimming pool, lynchings, all of that takes place in this room. We are using this room when we apply for the U.S. Civil Rights Trail to hopefully get a part of that to help bring in tourism to the town. So we spend a lot of time in detail on Gallery 1. If you look at the picture at the bottom left-hand corner, that is been commissioned by Larry Tinsley, our local artist, and that is a tribute to Hex Chapel because that was the center of the civil rights movement in Griffin. Next slide. This is Gallery 2. This is the Foundations Gallery. This is the gallery that shows the relationship between Julius Rosenwald and Booker T. Washington, because we wouldn't be here had it not been for that relationship. We talk about building a museum, grassroots movements of Griffin, things that took us to get here, the equalization school. So this is where you get the foundation for the museum and the story that we're telling. Next gallery. All right, this is the fun gallery. This is the recreated classroom. When you walk back in here, when I show people around, they get excited because they have the old desks they used to sit in school. We have tributes to teachers in here, to school leaders. This is just kind of where you feel happy. Go back and relive some of your school days, but with a Griffin twist. We're telling Griffin and Spalding County story in this room. Next gallery. This is the celebration gallery. This is where we celebrate the accomplishments. In this one, we have tribute to our professional athletes, our change makers. Some of these change things here locally, some of them on a national level. We had 3 people in the, to the microphone, I'm sorry. We had 3 people in the, on this board that were in the Carter administration from Fairmont. So those changes will be celebrated there. So this is the celebration room. And next slide, please. These are some of the awesome artifacts that we have been getting lately. If you see on the far left, we got Dr. Hood's original rejection letter from Emory University. In the middle, that's Wyoming Tyus's tracksuit. And boy, it's a little thing. She was a little teeny tiny woman, but it's, we have her original one. And on the left is a, Carl T. Horton. He was a Fairmont graduate. This is his Secretary of State award he won for a policy that he wrote when he was working in the Carter administration. So these are some of our great artifacts that have been gifted to the museum lately. The artifacts are with our Color Chrome, who's building the exhibits so that they can mount them and have them ready. And we are looking, hopefully, fingers crossed, for midsummer opening of the museum. Next slide. Any questions? This is Kelly and I's slogan for the museum, that we are inspiring, incredible in Spalding, because every day we have a new history story or something come about for the museum that's just incredible.
But tell me this, when is the finalizing of the name?
That will be for the event center. The
When is it gonna be?
That I don't know.
Yeah.
We have submitted a name to the naming committee, and then that's above my pay grade at this point.
It will be presented the first meeting in May.
First meeting in May.
All right, other questions on this?
I wanted to ask you, Heather, thank you so much. You have done an awesome job.
Thank you.
Having been around here and seeing how these things have been pulled together is really, really exciting. What is the plan for rotating these exhibits? I know in a lot of museums, something will be there 6, 9 months or whatever. I mean, it's
Some of these have been designed like the change makers there, that we can change those out for other people. We have already started the second, researching more people for the museum and gathering stuff for that. Some of that comes down to funding. It's gonna take every dime we have to get open. So, you know, it depends on how the funding and that goes to be exchanging exhibits. But we've already started the
GSBTA.
researching. Yes, ma'am, I've got my list for y'all.
The other thing I was gonna ask is that, in terms of the museum and is there, maybe I missed it, is there anything that's interactive in any of our galleries?
We have a couple interactive things within there. We have been approached by someone that would like to gift us a chunk of money to do some interactive exhibits. We're thinking about doing something outside, so if you come when the museum is closed, you can still interact and still get a piece of that. So yes, those are in the plan.
Okay. I mean, I think kids are more apt to pay attention if they're
Interactive and that. We don't have the budget, I'm just gonna be honest, for the high tech, like you go to some museums and you're pushing buttons. But we've had to be creative with what we're going forth with.
Thank you.
All right, thank you.
Any other questions on this? All right, do I have a motion to adjourn?
Motion to adjourn.
Have a second? Second. Have a motion and a second. All those in favor, please raise your hand. We're adjourned. Thank you. Back here at 6 o'clock.